The images used in these slides are for education purpose only. We respect intellectual property right of the original creator and owner of these images. If you are the owner of any of the images used in this PPT or have any concern, any issue, please contact us at sathi@iitk.ac.in and we shall remove the image. Welcome back, students. Today we are going to discuss some previous year questions related to application of biology unit, in which mainly I am incorporating all those questions which is related to drug and alcohol abuse topics. Okay, so let's discuss some questions. Question number 1: which of the following compound are secondary metabolite? Secondary metabolites. Out of these given compounds, which of the following one are secondary metabolite? A. Morphine, B. Heparin, C. Lecithin, D. Uridine, E. Curcumin. Choose the correct answer from the option given below. So in all four options, more than one options are there. So obviously more than one compound out of this 1 to E, all the metabolites or all the products, put it here, A, B, C, D and E category, more than one compound comes under secondary metabolite category. Okay, so we have to choose the right answer. You just take your 5 to 10 second time, and then after that we will discuss the right answer. Which of the following compound are secondary metabolite? Is this morphine, heparin, lecithin, uridine or curcumin? Okay, so now let's discuss. You know that out of these five options given over here, morphine comes under secondary metabolite category. Okay, this you know. While this lecithin, uridine, these are the intermediate product of various cycles, metabolic cycles. Okay, so this is not comes under secondary metabolite category, while this curcumin also comes under secondary metabolite category. So our right answer would be the choice number A and choice number E. So choice number 1 would be the correct answer, in which both morphine and curcumin are mentioned. Clear? Now, next question. Question number 2. Any chemical that cause loss of sensation. Loss of sensation is sedative, analgesic, anesthetic or stimulant. Any chemical that cause loss of sensation is sedative, analgesic, anesthetic or stimulant. Take 5-second time and tell me the right answer out of these four. Okay, so what is the right answer? Whether it is sedative, analgesic, anesthetic or stimulant? Stimulant stimulate that particular kind of function. So this is not the correct one. Analgesic just used for reducing the temperature, right? Anesthetic, again, anesthesia or anesthetic drug is used just pre-operation time, so that any kind of pain that particular patient will not feel. Okay, so loss of temporary sensation failing, this is with the help of sedative. Okay, so anesthetic also comes under a deep sedative category, but generalized loss of sensation occur with the help of sedative. ओके, सेडेट किया कर दिया जाता है और उससे फिर आदमी सो जाता है, लॉस ऑफ सेंसेशन खत्म हो जाता है. सो करेक्ट आंसर वुड बी द चॉइस नंबर ए. क्वेश्चन नंबर 3. स्मोकिंग कॉज लिप कैंसर, पल्मोनरी ट्यूबरकुलोसिस, lung cancer, gastric cancer, all of the above. Smoking. Smoking cause, this is related to our pulmonary system. So all the organ involved, right? So smoking cause lip cancer, quite possible. Pulmonary tuberculosis, yes, they have the chance. Lung cancer, it is also obvious, and gastric ulcer. So all of the above. Okay, so all of the above would be the answer. Choice number E would be the correct answer for this question. Next, question number 4. The drug marijuana is obtained from. This drug marijuana is obtained from cannabis sativa, Papaver somniferum, Atropa belladonna, or Dhatura alba. It's a very good question and very important question. It is given in your book. So, out of 4 choices, which one would be the correct answer for this drug, marijuana? Cannabis sativa, Papaver somniferum, Atropa belladonna, or Dhatura alba? Yes. So, this particular drug, marijuana, is obtained from cannabis sativa. Okay, you have to learn the name of the that particular plant and type of the drug obtained from which type of plant category. Okay, now question number 5. Select the false statement from the following. We have to select the false statement. A. Excessive doses of cocaine cause hallucination. Atropa belladonna and dhatura are also hallucinogenic plant. Cocaine is commonly called smack. Drug like barbiturates, amphetamine, benzodiazepamine are used as medicine to treat mental illness like depression and insomnia. So we have to choose the false statement. There is some kind of um, effect of any type of drug. Okay, if you learn that thing very quickly, you can get the answer. They have given us 4 different statements. Take your 5 to 10-second time and then quickly tell me the answer. We have to select the false statement. Excessive dose of cocaine cause hallucination. Atropa belladonna, dhatura are also hallucinating agents. Cocaine is commonly called smack. Drug like barbiturate, amphetamine, benzodiazepamine are used as medicine to treat mental illness like depression and insomnia. Okay, now let's discuss the correct answer. This fourth statement is absolutely correct one. These drugs are used as a medicine to treat some kind of mental illness, sleeping sickness, okay, and other kind of depressions. So this one is the correct statement. Cocaine is also commonly known as smack. This is again a correct statement, right? Atropa belladonna and dhatura, they both are having hallucination property. Okay, so this one is again a correct statement. While this excessive doses of cocaine cause hallucination, no, this one is not the correct statement. Rather, all three B, C, and D are the correct statements. So A choice would be the false statement. Okay. Now, question number 6. Given below are two statements, statement number 1 and 2. We have to choose the most appropriate answer out of these four. Okay, so statement 1, morphine lead to delusion and disturb emotions. Morphine. Okay, while statement number 2, they have mentioned that barbiturates called relaxation and temporary euphoria. Euphoria, right? So we have to learn the symptoms, right? Again, what is the effect of any kind of drug? What is the effect of morphine? What is the effect of barbiturates? So both statements are correct. Both statements are incorrect. One statement 1 is correct and second is incorrect. One is incorrect or second is correct. You have to analyze both the statement. morphine lead to delusion and disturbed emotions? No, it actually slow down the emotions. Okay, so this one is not the correct statement, but barbiturates called against relaxation or slow down your functions, and euphoria, a kind of different feeling, euphoria, temporary euphoria, is a symptom of barbiturates. So second statement is correct. So according to me, statement number one is incorrect, while second one is the correct. So correct answer would be the choice number four. Okay. Now, question number 7. Select the correct statement from one given below. Chewing tobacco lowering the blood pressure and heart rate. Barbiturate when given to criminal make them tell the truth. Cocaine is given to patient after surgery as it stimulates recovery. Morphine is often given to a person who have undergone surgery as a painkiller. We have to choose the correct statement out of these four. Just take 5 to 10 second time and quickly we will discuss the correct answer. Okay, now tell me, chewing tobacco lowering the blood pressure or heart rate or increasing the blood pressure or heart rate? Chewing tobacco actually increase the heart rate. Okay, so this one is the wrong statement. Barbiturates when given to criminals make them to tell the truth? No, barbiturate actually create a kind of euphoria situation. Okay, so this one is not the true statement. Cocaine is given to patient after surgery as it stimulate recovery. No, not at all. Cocaine is not help in a kind of stimulation or something in surgery, right? While slowing down, we can say. Okay, while morphine is often given to a person who have undergone surgery as a painkiller. Yes, morphine one can use, doctors can use for all those patients who has undergone surgery, as it act as a it's behave like a sedative agent. Okay, so yes, choice number 4 would be the correct answer. As a painkiller, one can have morphine. Okay, so this one is the correct answer. Next, okay, there is a they have given us a kind of structure of a formula, and we have to identify the molecule. This structure is also given in your NCERT book. We have to identify this kind of molecule. Identify the molecule given below. Whether it is belong to cocaine, okay, which is obtained from erythroxylum coca, morphine from Papaver somniferum, or cannabinoid, which is obtained from Cannabis sativa, or heroin, which is obtained from Atropa belladonna. It is a very, very important question. And yes, you can very quickly analyze that this structure belong to a cannabinoid from Cannabis sativa. Okay, so choice number C would be the correct answer. Question number 9. Which one of the following is not a withdrawal symptom due to discontinuation of a drug or alcohol? If someone want to discontinue drug or alcohol, that kind of person feels some kind of symptoms. Okay, so out of these four, which one is not comes under withdrawal symptom category? Is it euphoria, anxiety, shakiness, nausea, or sweating? Withdrawal symptom due to discontinuation of drug or alcohol. Okay, so if someone want to withdraw, someone want to quit the habit of drug or taking drug or alcohol, so that person initially feels some kind of symptom in which anxiety, he can feel anxiety, he can feel shakiness, nausea, and sweating. These are the withdrawal symptom, comes under withdrawal symptom category. Euphoria is not that kind of withdrawal symptom category. So correct answer would be the choice number A. Clear? Okay. Now next question, question number 10. Every time when the doses of a has to be drug has to be increased to achieve some kick that initially occurred in response to a small dose. Okay, this condition is known as rebound effect, tolerance, dependence, or addiction. Every time when the doses of a drug has to be increased to achieve a kick that initially occur in response to a small dose. This condition is known as, it's a very good question and very important question as well. Tell me the correct answer. Yes. Okay. So dose type which increase dose of a kind of drug which has to be increased to achieve a type of kick, that initial dose initially occur in response to smaller dose, that is called tolerance. Tolerance level मीन्स एक पर्टिकुलर लेवल को आप टॉलरेट कर पा रहे हो और आपको वो किक नहीं मिल रही है, तो क्या होगा, वो उस किक को लेने के लिए amount of dose बढ़ाता रहेगा that individual, whether it is alcohol or drug. Okay, so B would be the correct answer of this question. Okay, so these are the questions related to some topic of application of biology. I hope most of the answers has been cleared. Keep solving much more questions related to this topic, and if you have any doubt related to questions or any topic, please let me know. We will discuss it later on. Till then, take care, bye bye, and keep learning. Namaskar.